And so I'm gonna rapid fire give you a few here, and if you can't answer them, we want to make you an expert in the area that you are. If someone had a reaction to another vaccine, is it safe to get this one?
It is. It is. Depending on what that reaction was, if you had difficulty breathing or you had any respiratory problems with that, you at minimum need to plan to be observed for 30 minutes after you get your vaccine. Other certainly options are to discuss it with your allergist or to discuss it with your providers, but it is okay to proceed with getting the vaccine.
You showed us the efficacy between Moderna and Pfizer. Someone's asking, are they equally safe?
They are. We have mostly Pfizer information here on our slides. I acknowledge that, but they really are. When you read about the phase 3 trials for the Pfizer and Moderna vaccine, sometimes I find myself trying to remember which one I'm reading because the reactions are very similar.
What if I have symptoms after the vaccine? Am I contagious?
You are not contagious. So this vaccine is giving you a piece of mRNA. It's a piece of protein code, for example. And so there's no way that it can give you the infection. And then there's no way that you can pass that along then to anyone else.
So that fever is not a contagious fever, it's a reaction fever.
Exactly. That's your immune system powering up to be able to protect you into the future.
Will the vaccine work for the new COVID strains seen in the UK and the US?
Yes. As far as we know, the viral mutations are expected. That's what viruses do. So hearing about this mutation really isn't shocking, and we'll hear more mutations coming up in the future too. So we'll kind of hold the manufacturers responsible for ongoing testing and following up on that. But we have no reason to believe right now that we're not effective in these vaccines against those mutations.
Don't wait for the next vaccine. Get this one.
Yeah.
Okay. Should I worry my immune system is not revving up if I did not have symptoms after getting the vaccine? Should you worry if you don't have symptoms?
Yeah, absolutely. That's a really good question. We have found that younger people, so the study groups broke down, between those 55 and younger and 55 and over. And very consistently, people in the 55 and older group did not have as many symptoms after their vaccine. So it does have something to do with how strongly your immune system is able to respond, and age is a factor. So you shouldn't worry, but it is something you could expect.
Are there studies in progress for children under 16 receiving the vaccine?
There are, yes, that's right. So the Pfizer product is approved for people 16 and over, the Moderna for 18 and over, and there are ongoing studies for children in younger age groups. So I think we'll probably hear most, quickly about the 12 to 15-year-old age group next, particularly for the Pfizer product. But I expect it'll still be a while before we hear about younger kids.